This is the case of Ebstein's anomaly. What you see, this is left atrium, left ventricle. This is right atrium and right ventricle. This is TRZ. You see TRZ very close to apex, and this the septal leaflet of tricuspid valve has shifted towards apex. By criteria, the shifting has to be more than 7 millimeter per square meter of body surface area. So in this case shifting is more than significant one. We go next image. Again you see how this is forward flow, this is TRZ, this is forward flow, this is forward flow, and then this is TRZ, this is TRZ. So this is the case of Ebstein's anomaly. Why we say Ebstein's anomaly? Normally the tricuspid valve is already shifted apically compared to mitral valve, but when the shifting is more than significant one, that is more than 7 millimeter per square meter of body surface area, in that case you say it is Ebstein's anomaly. If simply measure in this case, you can easily see this is the measurement. This much is a 17 millimeter. You can see. So this is quite significant. This is flow across pulmonary artery. Main pulmonary is usually of normal size, but right atrium and lateralized part of right ventricle usually severely enlarged in case of Ebstein's anomaly. Again, the left ventricle chamber is relatively D-shaped. You can see both. This is forward flow. This is TRZ. This is TRZ. This is forward flow. This is TRZ. Now you can easily see. You see, in this case, this part is right atrium. This part is atrialized right ventricle. The part of right ventricle that has become atrialized, that is in connection with right atrium, that is almost has become like right atrium, and this is tricuspid valve. So from here to this much has shifting is almost 33 millimeter. That is why we call it Ebstein's anomaly, because shifting has more than 7 millimeter per square meter of body surface area. If you see the tricuspid valve and flow across tricuspid, that is regurgitation, you can see that the velocity across TRZ is very low, that is 217 centimeter per second. So whenever you see this TRZ, velocity has to be usually low. No high velocity you can find in case of Ebstein's anomaly. If velocity is quite high, then you have to suspect some other thing also. This is TRZ. You see, this is para-external short axis view. You can see how the Ebstein's valve that moves. Valve is quite large and valve movement is quite to and fro. In Ebstein's anomaly, you have to find out the length of free leaflet of anterior leaflet of tricuspid valve. So anterior leaflet of tricuspid valve has to be good for repair to occur. Whenever the free portion of anterior leaflet of tricuspid valve is significantly enough, in that case you can easily repair it. The free portion of tricuspid leaflet has to be good one. So in this case, you see the free leaflet is quite good. If simply you measure from here to here, this portion is free portion of anterior leaflet of tricuspid valve. this has to be good one for repair to occur, because this portion is utilized to repair the valve. Free portion of anterior left of tricuspid valve is utilized to repair the valve to construct the normal looking like tricuspid valve in case of Ebstein's anomaly. That is the point to remember. You see, IVC is relatively prominent in this case. Respiratory variation is less than 50%. This is transverse section. You can see this is aorta, this is IVC. So in case of Ebstein's anomaly, what you see, how much free portion of anterior left of tricuspid valve is there. That is the point to note. In this case, there is no ASD. Patient intermittent septum is intact. No ASD was seen in this case. But ASD is quite common. ASD or PFO is quite common in case of Ebstein's anomaly. Whenever that is present, ASD or PFO, if pressure is more on right side, that in that case, flow will reverse across ASD, and that will lead to central cyanosis. So you have to be meticulous to find out any kind of ASD in case of Ebstein's anomaly. And free portion of anterior leaflet of tricuspid valve is to be integrated nicely, so that free portion has to be decided. If free portion is significant one, good one, in that case repair is possible. In case of free portion is not sufficient, almost all parts of anterior leaflet is adhered to the free wall of right ventricle. In that case, repair is not possible. Free portion means the portion that is free to move, free for movement. It is not attached to the free wall of right ventricle. In this image, just see. This is the attached portion. This is attached portion, a portion from here to here. This one is free one. The free portion of anterior leaflet of tricuspid valve. In apical fourth chamber V, what you have to remember, the portion of tricuspid valve that is attached to septum is septal leaflet. Portion that you see other than this septal one, that is anterior leaflet of tricuspid valve, and posterior leaflet of tricuspid valve is only seen in right ventricle inflow view, that is modified parasternal long axis view, inflow view.